Hey, all you rebel moms out there. Welcome back to Bottles, Boobs, and Feeding Tubes. It's me, MPT, your partner from Bump to Baby and Beyond. Today, I'm going to talk to you about the difference between preeclampsia and eclampsia. What is preeclampsia? Preeclampsia is a condition that affects you during pregnancy. Usually around 20 weeks is when you're at risk for it. And it is characterized by when you go to your provider's office, or if you're checking your blood pressure at home, your blood pressure is high, and there's some other symptoms that you may be experiencing during that time. Some common symptoms are high blood pressure, protein in your urine. So sometimes we'll check your urine and you're probably wondering, like, all the times you go to your doctor's office and they're like, the first thing you do is pee in the cup. There's a lot of things we're checking for. We're checking for protein in the urine, we're checking for blood in the urine, we're checking to make sure you don't have a UTI, because untreated UTIs can also affect your pregnancy. So when you pee in that cup, there's a lot of different things that we're looking for. You will normally swell as your body gets bigger from a baby, but typically the hands, feet, and face swelling a lot can be a concern. Some people will notice severe headaches, vision changes, upper abdominal pain that's not common for you. Now, preeclampsia is not one of those things that you can predict before you have it. It's one of those, there's some risk factors. It could be first time mom. It could be that you've had it in previous pregnancies. You could have multiple pregnancies, like twins, triplets, quadruplets, or more. Sometimes older moms, older than the age of 35, are at an increased risk. One of the biggest complications or concerns with preeclampsia is it turning into eclampsia. So I told you pre-eclampsia, that's pre, before, eclampsia. Eclampsia is everything, including all the other symptoms, but the biggest one is seizures. So if you ever have a seizure during your pregnancy, especially if you never had seizures in the past, it's very important that you get immediate care. You may call your doctor and they'll send you straight to the ER. They may have you come into the clinic. It just depends on your OBGYN, midwife, or treating provider that's helping you through your pregnancy. How is this diagnosed? Well, most of the time it's that blood pressure. So when you're coming into the office and we're looking at all your vitals and your blood pressure is starting to increase, we might want to watch that and monitor it more often. If you're noticing high blood pressure at your office, they may send you home with a blood pressure monitor to keep check at home. If you have a history of high blood pressure and you're currently on medication while you're pregnant, it's another indicator that it may be getting severe or worse if your blood pressure is going up after you're on medication as well. We'll check that urine, make sure there's no protein in it. Sometimes you get a blood test. I don't know if you like getting poked, but you get poked a lot when you're pregnant. Not a lot, but enough for me. I was like, ugh. We're checking your liver and your kidney function. So when we're pulling all that blood from you, it's not a lot. It looks like a lot, but usually when we're taking blood, we're checking for different things. If you are at risk for preeclampsia or been diagnosed with preeclampsia, we're gonna check to make sure your kidneys and liver are functioning properly while you're pregnant. We're gonna check on your baby, make sure your baby's growing better, well, make sure that your symptoms aren't affecting the baby. So we may put you on a monitor and have you evaluated for a while. Treatment for preeclampsia is usually bed rest, sometimes, or modified bed rest if you hear that. That means no going back to work, resting, decreasing your stress as much as possible, checking your blood pressure, taking medications. They may put you on medications if they feel it's needed. Closely monitoring that baby. We still want to make sure the baby's growing well. And then we're also going to talk to you about delivering. If you're at the age of viability where the baby could possibly be delivered early, we'll let you know, like, hey, this is something that we're going to keep in mind. We're going to monitor you, but you may be induced before that 37, 40 weeks, depending on your OBGYN. If you have eclampsia and it's severe, sometimes you will have to deliver your baby in that moment. So if the baby is not of age to survive, then we'll have to talk about that process of what grief would look like if your baby does not survive. If you are past the term where your baby could be able to survive, then we'll talk about what it would look like, NICU stays, and complications that may arise with your baby and you during that process. They would treat you in the hospital, give you medications to hopefully prevent seizures, give you medication to bring that blood pressure down. Ultimately, we want the baby to be in as long as possible, but we also want to make sure you are healthy as well. And so the main difference between preeclampsia and eclampsia is the presence of a seizure. How we would treat you depends on the severity of your symptoms, how the baby is looking, and how you are looking. If you have had preeclampsia in the past, if you have heard of it and you have an experience to share, please share it down in the comments. If you have not subscribed to our channel yet, do so you can stay informed on other contents. And thank you for tuning in today.